Welcome to my channel. Thanks for visiting. Today, it is all about respiratory failure and precisely type 4 respiratory failure. Without further ado, let's go. Let's briefly define what respiratory failure is all about. Normally, we breathe in or we inhale oxygen and we breathe out or exhale CO2, which is carbon dioxide. That is what is expected in normal situation. But when that process becomes impaired, either because we are not ventilating fully and we are now dealing with low level of oxygen supply to the blood, which will lead to low level of oxygen supply to the organs, then we'll be battling with some metabolic derangement. Kidneys are recruited at this point because with decreased oxygenation and increased carbon dioxide retention, we will be dealing with low level of pH. Low level of pH is detrimental to anyone. So kidney will want to help to produce more bicarbonate to help in salvaging the problem of respiratory acidosis as a result of retention of more carbon dioxide. And in hypoxia situation, with low level of oxygen in blood, which is hypoxemia, leading to low oxygen supply to the tissue, which is hypoxic injury, then the respiratory system is defined as a failed one. So we will go through type 4 today, but we have types 1, 2, 3, and 4. In type 1, it is all about hypoxic respiratory failure, meaning there is no problem with carbon dioxide, but there is decreased oxygen supply to the blood and decreased oxygen supply to the tissue. Full info can be found through this link. Type 2 respiratory failure is all about hypercapnia or decreased ventilation. In this case, carbon dioxide is being retained. This is pretty common among people with COPD. Full information can be found right here when you go through this link. Type 3 is all about the time of surgery. So I tag it as operation related. Most authorities will tag it as perioperative. In this case, around the time of operation, particularly post-operative period, the respiratory failure that will occur that is as a result or related to that surgery is tagged type 3 respiratory failure. Full information about the role of anesthetic agent and functional residual capacity and positioning of the patient are all fully defined here. If you want full info on type 3 respiratory failure, you can click on this very link. Now, type 4 respiratory failure, otherwise known as condition that has led to hypoperfusion of many organs, including the respiratory system. Now, type 4 respiratory failure proper. This is all about shock. But let me quickly go through the 4 different types of shock that could lead to respiratory failure. Hypovolemic. The volume is low, massive blood loss, or persistent diarrhea or vomiting. I will go into causes and treatment in a bit. Cardiogenic. There's problem within the heart itself, arrhythmia or septal defect or valvular heart disease. Something is causing the trouble right here. Obstructive. Not enough is getting to the heart because it's being blocked on its way to the heart. Not enough is getting out because there's obstruction of flow. Distributive could be any of these. either anaphylactic as a result of allergies, septic from infection, neurogenic from damage to the nervous system, particularly spinal cord, and it could be eye center also, and of course adrenal crisis. All these four will constitute distributive shock. Now, in shock, generally, there is decrease of something. Decrease of what? Cardiac output. Cardiac output is low, so decrease in circulation of oxygen, decreased tissue perfusion. Multiple organs can fail, including respiratory system. Then we will have type 4 respiratory failure when shock is leading to multiple organ failure. Then with that, we can be faced with cellular death, and of course, the life is gone. Now, let's examine causes of type 4 respiratory failure. Hypovolemic shock. It could be as a result of massive bleeding or fluid loss due to diarrhea or vomiting, burns, and fluid loss into third space. Might be renal diuresis or as a result of medication like diuretics that is leading to the low level of fluid volume, so hypovolemia. If that is so massive that it has affected multiple organs, including the respiratory system, that is type 4. Also, cardiogenic shock, where we can be faced with arrhythmia. Arrhythmia, like any of those arrhythmia generally, and some defects like septic defects or valvular heart disease, even cardiac tamponade, or decreasing cardiac output, therefore reducing the volume that reaches the organs, having multiple organ failure. Obstructive. Obstructive as a result of decreased return to the heart, or the heart is getting enough, but when it comes out, there is obstruction along the path from the heart and get into the tissues. So in that case, we might be dealing with pulmonary embolism, pneumothorax, particularly tension pneumothorax, aortic stenosis, and also cardiac tamponade, all decreasing cardiac output and tissue perfusion is impaired. Distributive could involve anaphylaxis, where there's allergy and there's massive reaction leading to increased heart rate, breathing difficulty, chest tightness, can even lead to diarrhea, hips, itches, and swelling face, swelling everywhere, and multiple organ failure. Also, it could be as a result of sepsis, where in elderly or too young and battling with decreased immunity are easily predisposed to infectious agents and their toxins. So toxins from bacteria mostly, and also fungi, could lead to septic shock. Sometimes virus could also produce that. Here, the blood pressure will drop, so leading to decreased tissue perfusion. In fact, clots could also be formed, impeding the flow of blood, all from sepsis, and it could lead to death as well. Neurogenic is part of distributive shock. In that case, there is damage to the nervous system, particularly the spinal cord. But when the central nervous system is in trouble, affecting medulla oblongata, we might be in trouble as well. And the issue here is there is lack of response, to all the signals that are supposed to set the respiratory system in motion. Then adrenal crisis, Addisonian crisis. All these could be responsible for shock generally. Now the treatment. I will not go into the specific treatment here because there will be a separate presentation on that. So first thing first, we must check the airway. And what are we looking for? Any blockage, any secretion will function as it is appropriate. Then what is the oxygen level? We have to give oxygen right now. But remember, in COPD, once we have O2 side of 92%, we are good to go. We are fine. We cannot keep COPD patient on supplemental oxygen for too long. If we do that, we might be doing more harm than good. We should look for bronchodilators as may be needed. Inhale corticosteroids or steroid given intravenously. Then we might quickly, depending on the judgment or on the state of the patient, go into endotracheal intubation. And sometimes tracheostomy might help. Then we'll move further because this is about shock, right? We'll look for the specific shock that is responsible here. Let me just give one example, and that will be hypovolemic shock. If we need IV fluid, we'll put it up. The type of IV fluid needed will determine it. Then, do we need blood transfusion? We'll make that determination. All should be done quickly and get the respiratory system back online. We might end up in surgery if we are dealing with serious defect within the heart, and the surgical procedure will help. With this, I've come to the end of this short presentation on type 4 respiratory failure, which is all about the failure of another organ or the failure of another system affecting the respiratory system, or the volume in the system, or the infectious condition, and so on, now affecting the respiratory system. All about shock, hypoperfusion, decreased multiple organ failure, including respiratory failure, and that is type 4 respiratory failure. Thanks for listening. Please remember to share this. I appreciate it.